Okay, that's enough of that. Live from New York, I'm Lou Bernardi. This is Benefits with Friends. Really excited to have two special guests today. They're going to join me in a second. So, Benefits with Friends, for me, this is a place where benefit advisors, solution partners, benefit decision makers, anybody who really wants to kind of explore an alternate world of healthcare and benefits that are really making an impact throughout the country. Some great things are being done. And I am going to bring Kimberlee Langford and Crystal Kowalesky. Kowalesky, I'm butchering it. I'm sure she's going to correct me in a second. On with me. Let's bring them on right now. So, Kimberlee and Crystal, hopefully you can hear me. Good. Hey, how are you guys?
I was just going to say, when you said live from New York, I was as old habit. It's Saturday night.
It's Saturday night. It's Thursday afternoon, pre-blizzard. So I forget where you guys are, but there's a big storm coming. So it's great. And this is the first time there's going to be three people on the live show. So this is great. So for people who don't know Kimberlee and Crystal, I'm going to make a very brief introduction, and then I'll let them introduce themselves. But, so they're with a company that we've worked very closely with over the last few years called Specialty Care Management. And Specialty Care Management is a company that really helps employers and their members with things like cancer, dialysis, some really, really serious conditions. And, their solution not only helps employers of really any size group. Of course, I'm going to get a phone call right in the middle of this, and my volume's on. I don't know how to turn my volume off. TV. No. Anyway, so they not only help them control the cost, but then they also bring in the clinical element and make sure that these people are getting the absolute best care and know everything they need to know about their condition, their treatment, the care, and all of the options that are available that, very often elude people because, let's face it, health insurance companies provide a great, valuable, a resource, but they're not necessarily always there to guide members, through the care process. And the healthcare system is great. It's filled with great people, but there's also people that take, advantage of patients and maybe don't think that they need to know everything they need to know. So I'm going to turn it over to Kimberlee first. If you could tell us a little where you are, a little bit about yourself, and something about specialty care management.
Oh, it's one of my favorite things to talk about. And I'm super excited to share some time with you and to Crystal. Thanks for having us on. So
my pleasure.
I'm a nurse. I've been a nurse for a long time. Every year it's a heavier face cream. Isn't that fun? But at any rate, so over the past probably a couple decades, I've really honed in and have developed a yen and a passion for kidney disease and dialysis, simply because what I've seen play out over and over and over again in our industry, regardless of what we say we're doing in healthcare, what I see is that people who have certain comorbidities and risk factors, it feels like, namely dialysis and hypertension, cardiac disease, it feels like we put these people on a treadmill, or they put themselves on this conveyor belt, and we watch them go right off the cliff. And it feels like watching somebody drive their car into a brick wall and nobody's telling them to look out and to turn it around, because there's a ton of money when they crash into that wall or they fall off the cliff. Yeah. And I really, over many years, there's not a strategy that can really bridle an otherwise unbridled industry like dialysis. Yeah. Until I got to know Specialty Care Management, and we've existed since, for a long time, but since 2002, we've really had a unique approach to dialysis. In particular, our specialty is in truly mitigating the risk of high cost claims in a holistic manner. It's much more robust than it's cost containment for sure, but it's much more robust than just that. And That's largely due to the prowess of our leadership team, Crystal being one of those phenomenal members. And she's got her hands in everything. So
That's a
no
great
pressure.
segue over to. That's a great segue over to Crystal. Crystal, what do you have your hands in?
Everything.
Yeah.
Everything.
First of all, thank you so much for having us. And I love the name of your podcast.
Thank you.
Kudos on that.
Yes.
And my last name is Kowalesky. So it's Crystal Kowalesky, as in Killer Kowalski. So
Yes.
you can't forget.
All right.
And I came to Specialty Care Management from education background. So it's great to, have that background, because I can explain to everyone exactly from the member perspective to potential clients, basically everyone that I work with, exactly how our solutions work and how to implement them, and make sure that everyone is on board with what we're doing and understands it fully. So it's really nice to have that background in education. But like Kimberlee said, I kind of have my hands in everything. I help with implementation, and then I also work with our clinical side. So when we're doing case management, I help coordinate that. And I also work with our claims department, making sure everything's running smoothly. And then lastly, I communicate with the executive team to make sure that we're keeping up that forward vision that Kimberlee talked about, and making sure it all comes together and that we continue to be a leader in this industry.
Education is really key to the whole thing, because I was in my past life an insurance broker for 25 years, right? And a lot of people would say, "Oh, you're a broker," but I'm not anymore. Insurance broker sells insurance products, and that's what I did. I was very good at it. I did it since 1992 through the end of 2016, and I've had my own agency for quite a long time. And I decided to focus specifically on that instead of my GA background, where I was essentially the broker's broker. And when I ended my GA career, and I was sitting in my office, this office here, and my phone wasn't ringing from brokers, I said, what am I going to do? Where's my differentiator? Who is my prospect? Who am I targeting? And I had an awakening, because I started thinking back to the hundreds, if not thousands, of open enrollment meetings that I had gone to. And at the end of the meetings, I always, offered to stick around to answer the questions, personal questions from people. And those were often the most difficult times, because that's when people came up, and I had people cry on my shoulder, because even though I was doing a great job helping to control the insurance premium, which was 100% of where the focus was, right? Because that's the game. That's, you get your renewal, you get a number, you go to market, you get a new starting number, and then you trim it down to where the C-suite needs HR to be. And that almost involves either passing more premium cost onto the members or watering down the benefits, higher copays. And people ultimately couldn't afford, even if it was a $20 increase in a prescription copay. I'm relatively healthy, middle-aged man, but there's people a lot younger than me that were on 10 medications a month. I couldn't believe it. So $10 or $20 increase for 10 scripts. Now they have to decide, which ones am I taking? Right. There's a difference between putting food on the table. So that was kind of the start of it for me. And then, then I realized it's the data, right? It's the actionable data, which up until then, there was none. We don't get any data. Insurance companies own the data.
You don't need the data. I've got you.
Yeah,
I'll watch it out for you as long as my pocket's full. I got you.
Right. And the narrative is, and still today, people ask me, how can your partners, specialty care management and other different cost containment partners, we call them cost containment partners, but it's really quality improvement partners. The byproduct is the savings. None of us are doing this because it's less money. We're doing it because the product that we're delivering that member, that patient, is better. And it just so happens that the best care is typically less expensive, because those are the doctors that do it so often that the volume that they're doing allows them to do it at a lower rate, right? Any orthopedist will do a shoulder surgery, but do you want to go to the one that did one shoulder last year? He's really an ankle specialist. you know, you don't want to find out afterwards that, you know, your arm is now moving like a foot should, you know, and that happens, right? But that's how I came to meet you guys, because with the stop loss that we're writing, we have some, you know, some partners that are doing some great things, and, you know, kudos to them. They're going beyond what the customer's asking for, because the expectations of the consumer is what's too low, because they don't know what they don't know, right? And they're dealing with partners that are just meeting their expectations. But you want to exceed them if you're doing the right thing, right? Because we want to progress. So that's when I think the first email I got from Dave, Kimberlee, with the projection, because we happen to have a member on one of our groups, no, not going to reveal any information, was that someone was going to start dialysis. And I nearly fell off my chair when I found out that here in New York, the average, because there is no real cost, right? Every insurance company's negotiated fees, if you want to call them discounts, are all over the place. But on that particular group, it was $450,000 to $750,000. And this is a self-insured,
After
group.
discount, right?
After discount.
Yeah. Mm-hmm.
Right? I mean, it was over $1 million in probably bill
Yep.
charges.
Mm-hmm.
And then I found out what your flat, case rate is. So I don't know if either one of you want to explain, like, so we're kind of, tell us what specialty care management, how it differs from the way it reimburses. And then we're not even talking about changing providers, which in some cases, some of our solution partners means, we have to change things. We're recommending different things.
Mm-hmm.
In your case, you're providing the same care with the same providers, right? We're going to also make sure that they're the best providers. I mean, that's just an added benefit of what we're doing. But explain how that works. Like, how can you get a better price than Cigna, for example?
Well, can I just because you've said so many delicious things, and I think sometimes,
time to jump.
So the nurse in me, my loyalty is always to the patient. I can't not be. That's why I'm here. That's why I exist. Everything I do is about, I love people, right?
Yeah.
But what we have to understand too is that cost is a huge factor. And I think for a lot of us, employers in particular, doesn't matter how good your care is if you can't afford it. But the cool part is, whether it comes from, and a lot of us would like to say, we're really looking to provide better care for the member. That delights me. But my first look is going to be at the price tag, right? So when we're sitting down with employers, this is my budget. So I need to state the price is absolutely the driver. But the cool thing is that, like you mentioned before, is that we come to that price when you do the right things for the right reasons in the right way. That it's a natural outcome,
right?
And a lot of the reason why dialysis in particular is often felt by employers and by patients alike to be very predatory. The reason why it's felt to be that way is because that doesn't exist, right? So, so our strategy is unique. So I might bat it over to Crystal. Do you want to explain it? And
yeah, absolutely, Kimberlee. Thank you. And to expand on some of that as well, when you're talking about at the member level, when you're receiving dialysis 3 times a week, you don't want to have to travel an hour away when you have a dialysis facility that's 20 minutes away. So it's just a great quality of life enhancement and stress reducer that our approach removes the network restrictions, such as you have to go to a certain facility. And it usually removes also the copay or the deductible for dialysis. So from a member perspective, this is just huge.
Absolutely.
When they come onto our program, we do concierge onboarding, which includes this wonderful one-on-one experience where the member gets to talk to a human being about the benefit, about if they're going on dialysis, any questions they have. So it's just from a member perspective, it's much more robust than what they would be getting typically, and much more one-on-one, which I like that personal touch, because when you're entering dialysis, you're scared. and
Absolutely.
you have so many questions, and you don't have many people who have time to sit down and answer your questions.
Right.
So just that personal touch that you get through this solution. We all know that bill charges are super arbitrary. They're all over the place. It's almost like put your hand in a bag and pull out a ridiculous number. And that's what a lot of these dialysis facilities are doing. You're looking at bill charges in that area well over $1 million, well over. And so our approach is a cost up approach. We're taking bill charges out of the mix.
Right.
And by doing so, and by writing and doing a legal review and having plan document language to support that, you're basically removing all of this awful variability for the plan of, am I going to hit the lottery? Am I going to happen to be at a dialysis center that happens to have a good rate for this network?
Right.
So all
Or
that
am I going to get
variability.
sued because of my discount?
Oh yeah, all that stuff. And so when you remove that and you have a capitated case rate, and I can have a line item budget, line item, I'm faltering here, expense.
Yeah.
It's much better than this month. There was, for whatever reason, a $50,000 increase in bill charges, or if your discount is related to how much the vendor is getting paid, then all of a sudden you're still beholden to bill charges. You're still worrying about, this month, are they going to charge $120,000 in bill charges? And then suddenly this great discount I have that's based off of a percentage of savings, suddenly I'm paying a lot more for that service. So, in either construct, you have variability that I think is very worrisome for plans. And once you remove that variability, it's much less stressful, and it's just easier for both the plan and for the member. So I kind of love when a solution works for everyone involved.
Yeah.
And that's what I think we do.
Now, so with you guys, so, for me, again, it's working with the right third-party administrator and case management, right? So that you're actually looking proactively, mining through a population, whether it's cancer or precancerous, or, do we need to wait until someone is actually starting dialysis to be able to even help that person? Right? Can we get involved before, because we're being proactive, right? So it just came to my mind. But.
So here's the thing, and if you can't tell, it does make me angry, quite honestly, because I can't tell you how I've talked to literally thousands, tens of thousands, a whole lot of people across the country, and it's not uncommon. Sometimes I'm thinking of a conversation I had with a gal who said, no kidding, right before you called, my doc just told me I needed a kidney transplant, but I've never had any problem with my kidneys. Then you go back and you look into their medical records and you see that this has been happening. Her kidneys have been declining for like 10 years. And now it's a surprise. And the employer's just hearing about it, right? So now their hair is on fire, but the member is also in this state of, and it feels like dialysis feels like a surprise. And it shouldn't be, right?
No.
So you bring up a great point, and I'll say this twofold, because one of the great value propositions that we bring to the table is that it doesn't matter if it's a surprise or not, right? So we can be deployed in a situation where it is a surprise. You don't have to wait for a renewal. We can come in and put out your fire.
Right.
But you're absolutely right. We can see this happening in data. Now keep in mind, 90% of your patients are with a really low kidney function, like knocking on the door of dialysis. 90% of those people are not diagnosed with kidney disease yet. They have it, but they don't have the diagnosis. So it's not going to show up in claims. You're not going to see a kidney disease claim because it hasn't been diagnosed yet. But here's the other part too. The stop loss knows that dialysis is coming, right? Through claims, we can see things like diabetes and gangrene and heart attacks and sleep apnea and obesity and all these things that we know lead to kidney disease. And a group is going to be rated for dialysis long before oftentimes they actually have the claim. You're going to pay for it, right?
Right.
And so the beautiful thing about data, and particularly for savvy brokers, advisors, consultants who are, doing that work, and we love to help our partners do that. We'll actually go through the data and not just, there's the algorithm that we use to sift through that, but having Crystal and I were talking about this earlier, having the Sherlock Holmes, having the clinician to put eyes on that data. When a clinician, when we look at the data, we can see the person. I can see swollen legs. I can see that they've been in the ER. I can see that they're, I can smell them. Right.
Mm.
And oftentimes through data, we can see that this person's probably, a lot of times we can look and we can say, I'll bet you anything this member's going to go to dialysis within 3 to 6 months.
Right.
Or I'll bet you they're going to go within the next year. Or, it may be longer than that. And that's honestly, the cost savings that we can obtain through our unique case rate is fantastic. But the other thing that I really am proud about our company for is that the best savings we know are to not need the case rate. Mm-hmm. So being able to look through data is much like when you go to see your physician, right? A good physician doesn't just look through his little medical dictionary and say, oh, let's try this diagnosis and see if this fits. No, he's going to draw some labs, going to listen to your heart and your lungs. He's going to come up with a diagnosis based on data, based on an assessment. Well, that's much like what we do with claims, right? And from that sifting and that analysis of the data, then we can come up with a savvy broker, advisor, consultant knows what the needs are of the group, and they know then what to prescribe for the group. Right. I think that's beautiful. That's how it should be, don't you think?
I agree 100%. I kind of think of it as, a handyman. Some people just have a hammer. So if it needs to be hammered, they're your person. But I like to think that I walk around with a tool chest, but I don't talk about all the tools, right? There's certain things that make sense. Like if I'm not going to, if it's not broke, I'm not going to break it so that I could fix it. But sometimes you don't know what's broken until you get the data.
Yeah.
So, we sit there and I talk to diabetes management companies and musculoskeletal, companies that can help with so many different things. They're on call, but I don't have the data to support the need for them yet. And frankly, it's because, the clients that we're working with, we're taking from kind of what I would call the old-fashioned TPAs and bringing them into the new, they're not brand new companies, but they're TPAs that are doing things differently, right? So they understand their value proposition is being able to work with outside vendors, right? They're not carrier-owned TPAs that have their specific, embedded solutions that can call themselves different things, but really aren't doing anything, right? We're replacing a TPA now. I'm not going to mention any names, that we were looking at some large claimants, and I was questioning some of the claims. They said, oh, would you like us to send these to case management? I was like, you're asking me? Like, these were claims from July. Why weren't they sent? Well, no one asked us to. But I just dropped
and
it.
we sit and we watch them fall right off the cliff.
Yeah. It really shouldn't be called self-funding, because that's been around for so long. And what people are able to do today really is so night and day to what you were doing. If you tried self-funding 10 years ago, and especially if you did it with a BUCA carrier or a BUCA owned TPA, you were just funding your same claim spend a different way. There was no value. You weren't looking to help optimize, like what we call building a high performance health plan. It doesn't just happen overnight. We're looking to fine tune it over time, like it's an engine in a car. Like right now we know it started and we can drive down the block in it. But is it clunking, down the street? Can we get more out of this vehicle? And that's the way I look at it. And that, we're so happy that we have access, and that we found companies like yours through, some of them directly, some found us, because of our presence on LinkedIn. But a lot of times it's because we're just in the right space now, and there's and people are searching for like-minded solution partners, right? So
absolutely, yeah.
So you said
somebody's going to look out. Somebody who's going to look out for you, right? Kind of like what you mentioned earlier. A good friend's not going to let you crash into the wall, right? They're going to tell you that.
Well, I say this on a lot of the calls, like, when I was going through that whole process and trying to evaluate, like, what was I doing for 25 years? Because I really never connected the healthcare to the health insurance. Because I just assumed, they're getting the best prices. The claims are the claims was what people said for the longest time.
Yeah.
And we believed it because the data wasn't there. And
well, as we know here, the best cost containment tool is to not need it, right, Crystal?
Yeah,
absolutely. Yep. And you only achieve that through dedicated coaching. To use, go ahead.
No, go ahead. I just wanted to see if I can actually bring this slide on because, but yeah, no, it's exactly the dedicated coaching. This isn't, again, all of the things that our partners are capable of, some that we're actively working with and others that we hope not to need, right? It would be lovely if none of our clients ever needed dialysis. We're not hoping for that, but we know that when they do, we have a partner that we can call that's going to be, on the ready. And it's not because, like you said, someone needs dialysis today and we're just finding out, or we want to save. We want to make sure that we're with the right partners that are looking at the claims on a regular basis to say, hey, you have a population here that are pre this or pre that. And maybe some education and outreach would be really helpful because it doesn't appear that they're adhering to medication. Sometimes it's about, we could avoid something completely if we just make sure that people go for their physicals every year. They don't understand even today that preventative care is covered at 100%. There's not going to be an out-of-pocket cost. And so many people have high deductibles these days, so they just turn off all healthcare. We don't want that to happen, right? We want to make sure that if we need to waive costs, we can do that. And I think, for a lot of the solution partners, that's the added benefit, is that when they go this route for this alternative treatment plan, let's call it, not even though it's not really that, it's just we're doing it in a different, bundle, it eliminates the cost to the member completely, right? So you had shared, Kimberlee, this slide with me. So I pulled it up here, and I don't know if you could kind of go over what this. I think this involved 4 members, right? It wasn't just one. I think it was the cost summary here was based on 4 people. If I wasn't mistaken.
Yeah, that looks about right here. I'm just pulling it up on my end. So a lot of times what we'll do when and Crystal can jump in too. So sometimes a group will come to us and they have, their house is on fire. We have these members on dialysis. Then we'll go through, if we have access to claims, we'll look at those claims, and that's how we determine. And so I might just say this, since we're talking about data in particular, it's really important when you're working with solution partners to not just ask for what am I paying for dialysis, but also you want to ask for the associated fees, right? Just ask for what am I paying for dialysis. We see this happen all the time where they'll just give you what's being reimbursed to the provider. It's kind of like if you went to your bank and said, hey, what am I paying for my house, right? And they only gave you the principal amount and not your interest. It can be really misleading, right? Sure. So the important thing to remember is that we're looking at what's the total cost and the risk to the plan. So we'll look at these members and actual claims, if we can get that, and the fees associated with whatever discount's been obtained. And from that, we'll come up with an annualized cost that we know is being billed and the cost that's being actually paid. And then, like Crystal mentioned, we will, with our cost up approach, we use a pretty sophisticated model to craft and underwrite this flat fixed case rate. It includes the provider reimbursement. It includes the legal review that Crystal talked about. It includes the white glove, the nurse support that really helps these members not only thrive on dialysis and stay out of the hospital, but help make sure that they understand their Medicare benefit, right? All of that is all included in that flat fixed case rate. It never changes. So sometimes you have situations like coming out of the holidays, you'll have sometimes people fall off the wagon. You got to remember that these members are sick. not just because of the dialysis, but because they don't really understand how they got there in the first place. Right. So that support is really important. And all of that's included in that flat fixed case rate. And so what you see here is a reflection of that, that analysis, if you will, of this is what your group was billed for dialysis. This is what the case rate equivalent, this is what you actually paid for. So that CRE or case rate equivalent, that's what was paid to the provider and the fees that were associated with that groovy discount that you got, right?
Right.
So all of that that was accompanied, that actually went into paying for that member's dialysis and our case rate, which is inclusive of all that other stuff, right? So it's really, we really want to look at apples to apples. And from that, that's where you can see how we stack up in relationship to not only build charges, but are we going to be able to save you from your current cost containment strategy? And most of the time, we do. And along with that incredible savings, what you have there is the predictable amount that you can take to stop loss. So when you look at upstream mitigation, how is this? Because a lot of times people will say, well, I just want to make sure I'm, who's going to pay for it right now? Well, it's all going to come back on the group, right? In terms of your renewals and in your stop loss. So it's really important to be able to demonstrate that. It's incredible. Plus, as Crystal talked about, really making sure that it enhances the value to the member, right? It shouldn't be disruptive to the member.
So looking at this, if someone, so on the left, the total charged amount, right? So the total charged amount was just over $6 million. The paid amount was 1.44, right? And then your case rate, and this is for about 4 cases, I think, right? This isn't just one thing. So about approximately $480,000 savings for 4 members. And I've seen, and you mentioned a great point. If you happen to be self-insured, this is crucial. We've actually gone through a couple of renewals where there were stipulations in the rate, and especially if there was any lasers, which aren't always a bad thing, right? The lasers, if you are in using this solution, and the lasers this if you're not, right? Because if a smart stop loss company understands what's happening in the revolution that's happening in healthcare and in health insurance these days, it's just not, well, everybody's just paying the same thing. The claim is not the claim, and that can be further from the truth. And I'm thinking about I'll take this slide off now, but I'm thinking about a fully insured, people who are fully insured employers, and they're thinking, oh, we don't have to worry about this. Our insurance company's paying it all, and they don't realize, right? So even though a lot of large groups or mid-sized companies that are fully insured, they think, well, we have a $100,000 pooling limit, so we're only getting charged towards our claims the $100,000. But they don't look a little bit further down their renewal and they say, okay, well, now what are the pooling charges? And if you have something like this that's out of control on a fully insured plan, right? Not only will they increase your pooling level a lot of the time, but you're just paying for it anyway, right?
Absolutely.
None of it just disappears. So a lot of companies that are out there that are fully insured think, well, I'm not a good candidate for self-insuring because I have bad claims. It's even more important for those groups to self-insure. They don't understand what self-insurance is. Self-insurance is not, well, we pay our own claims and all of the burdens on us. And it's the best way to be able to mitigate and eliminate the artificial prices that are especially in things like pharmacy and specialty drugs and injectable drugs. I mean, you name it. You talk to a lot of the same type of partners that I do. So yeah, it's just so eye-opening when you see it for the first time. It's very intimidating. Like I call HR and CFOs and CFOs, I call them benefit decision makers, right? Because they're tasked with that, right? And then they have all of these other people that are helping them with their decision, and very often those people that are supposed to be the experts are also not informed. They're selling insurance, and they seem really good at it, and they provide really great service. But there's just so much more that's lacking, within the thing. So we're coming up on about 40 minutes, and I don't know if I prepared either of you for this, but I'd kind of like to have like 3 takeaways. Like if there's 3 things, if you were talking to, you could talk to the individual, you could talk to the benefit decision maker. If there's something you could say, these are things that you can keep, on top of mind when you're kind of evaluating these things, and ask yourself these questions. Are you getting this level of insight and support? Like just anything that comes to mind, because I don't think I prepared you for it. I usually do.
Crystal and I kind of chatted. We chatted about that a little bit. Do you have three key nuggets that you want to share, Crystal?
Nuggets.
Okay, 3 key nuggets. There are ways you can position yourself to have a win-win-win, and SCM can help you with that. So you can enhance member benefit, you can limit your risk, you can have a capitated case rate, and protect yourself legally in the plan legally. So it's just a win-win-win. I guess that's one point.
Look for the win-win-win. Wouldn't you say, Crystal, that to
3
get
wins.
the win-win? Well, to get that win-win-win, you really have to have the right partners, right? The partners that are aligned in the philosophy, right? That says, well, it's not really good for me if it's not good for you, if it's not good for your partners, correct?
Right.
Correct.
So the win-win-win, we can describe that, I think, as one key nugget.
That's one key nugget. And then the second nugget I would say is, data does have sometimes limitations. We all know this. And for the individual, the limitation of data is just being confounded by it. And so if you're going to utilize SCM for something like CKD case management, you're empowering the individual and the member to take control of their health and avoid those dire outcomes by managing that data in a way that makes sense to the individual, instead of just having numbers thrown at them. Because like Kimberlee said, oh, well, you didn't know that your kidney was failing? Well, no, because I don't know how to read labs. I'm just a person. And I think we've all been there. And then data also from the plan decision maker perspective. Sometimes you might ask your TPA, well, what are we paying for dialysis? And you might get a number that's not really rooted in reality. So to have a company like ours to go in and say, this is what you are actually paying, an expert comb through your data, this is the real cost, I think empowers the plan also to make decisions that are best for the health of the plan.
I guess I would say that's make sure you get the real block of cheese.
Exactly.
Right?
Wait, are you in Wisconsin? Are you in Wisconsin, Kimberlee?
Not the Swiss cheese. Well, sometimes we'll look at claims, kind of like what we were talking about before, and you see, that you can tell they've asked, what am I paying for dialysis? Well, this is what you pay for. You pick and choose. Right. So the data is really only showing maybe, one time a month.
Right.
And it's not inclusive of the fees. That's what I call Swiss cheese data. You can't do anything. If I want to come up with a diagnosis, if I was a physician, I'm not, by the way, but if I was, right, and I wanted to make a diagnosis, I wouldn't just base a diagnosis off of just what's your red blood cell count, right? I want to look at the whole panel. I want to look at the whole person. So making sure that you're getting the real data. And then to Crystal's point, knowing those options that make that data actionable.
Right. One thing I'm in the process of writing a book for the last 2 years. So who knows if it'll ever get done. I promised myself by the summer I'll have it done. But as I'm going through this whole process, one of the things that I'm very conscious of is that somewhere in the last 25 years, the owners, the C-suite stepped away from the decision. When I used to go to open enrollment meetings back in the 90s and the early 2000s, they were always there. It was a financial decision, and they treated it that way. But the lack of data basically said, listen, it's not worth their time. There's no data. There's nothing for me to...
Or it was confusing. They couldn't act on it.
Right. Or I think I mean, for the most part, from what I saw, just it wasn't there. So they said, listen, it's not worth, this hour is not worth my time. And they passed it off to HR. And HR are wonderful people, but they are the most overworked people at every company. They wear 30 hats. Like you couldn't even put, I don't know how they could fit what they do on a resume on both sides of the resume. So what we're talking about is not throwing more data at them, which is going to be so overwhelming. They don't have to do anything. There's nothing more for the decision makers to do. The data isn't something that's being spit out to them. The data is something that your solution partners are mining through, and they're not going to bother you, right? So I'll give you an example, because this was a new world for me until about 5 years ago. I get an email on a whatever, any given Thursday, whatever, that says from the solution partner, we've identified a member who is just was certified for an injectable medication. And that medication is about $115,000 twice a year. That's going to be the billed rate for an injectable med. And it was for someone who had multiple sclerosis. It turned out to be a young man, relatively young man. So I'm like, okay, I got an email. I wasn't doing anything more, right? But we have the right partners in place. And they just said, can you please reach out to the HR person and have them let that member know, after we identified who the member was, that they're going to get a call from XYZ company, because they're not used to this. This is new healthcare, right? Yeah. And just please let them know that to take the call and know that this is part of their health plan. So what happens, right? $115,000 twice a year, $230,000. The estimated carrier paid amount, what is going to be about $80,000 twice. So $160,000 for the year. And that's not even the worst part. The worst part for me, and my greatest fear, is that this young man goes to the facility as an outpatient, gets this injectable medication. 3 weeks later, he's feeling amazing. His life has changed. And then he gets his EOB and his invoice for $7,500 because it's covered under the medical plan. And it's his deductible and his co-insurance. He's maxed out and he never gets it again. That's my greatest fear. Like, I lose sleep over that. Knowing that the call instead, and I get emotional when I think about it, because I was telling my daughter about it recently, because she said, Dad, what do you do? And I was going through the story. I want to be on that call when that person gets a call and says, by the way, before you get this done, if you go here where your doctor referred you to, it's going to cost you this. Or we can have a nurse practitioner or physician's assistant come to your home and it costs you nothing. That's the difference about what we're talking about now. This is people's lives. It's quality of life. And, that's the thing that makes me, I get pumped to come to work.
And it always benefits, it benefits everybody. Our Bob over here, he'll say it's the tail that wags the whole dog, right? Because that member in the middle, when you take care of that member, they drive everything.
Yeah.
And so you're absolutely. Yeah.
I mean, for the C-suite, it's $100,000 savings, right? Mm-hmm. What can you do with that $100,000, in so many different ways? For me, it's that person who happens to be a single parent of 2 children, young children, who has a new lease on life that I'm just so afraid wouldn't have been there. Because let's face it, most people don't have $7,500 laying around to pay for healthcare when they have to deal with food and gas and rent and car payments and college and all of those other things. So, anyway, that's I love to tell that story because
you're talking really, my language. I've had those conversations too.
Yeah.
Well, here's the bottom line is that at someday, you and me and Crystal, someday, we are going to be consumers of our own industry.
Yeah.
At some point, we are going to be sleeping in the beds that we made or didn't make, right?
That's right.
Or it's going to be somebody that we love and care about.
Yeah.
So it really behooves us. When I do good for you, I'm automatically protecting my own. It's all very selfish on my part, right? When I do my part to make our industry better, it is going to come back on me.
Right.
So it's not just a matter of, anybody can make profit for a minute, right? I love the fact that, for you and specialty care management, And there are so many good people in our industry who really are doing good things.
Yeah.
That it is that, like Crystal, it is that win-win-win, and it's all going to come back on us. If it, hopefully, right, we are doing the right things for the right reasons and in the right way with the right partners.
No question. Absolutely. Well, thank you both so much. This was awesome. I spoke on the first one for 5 minutes with my sound on mute. So just let you know. So this was great. I always check, is my sound working? So no, this was great. Thank you both so much. I don't know if you guys are going to any conferences. I'll be in Arizona.
Yeah, I'm going to see you in just a couple weeks, my friend.
Yes, I will definitely see you there.
Absolutely.
Going to a couple this year. So yeah, can't wait to get out and see you. And thank you both so much. This was awesome. And hopefully you had a great time. You guys were great guests. And I'll get a tape of this over to you guys right away.
Thank you.
Thank you so much.
Thanks for having us,
Thank
Luke.
you.
Our
Take
pleasure.
care. Bye-bye.
Ciao.
Bye-bye.